Hi. So I have done several tapes on things which are theology, like the origin of universe and the how the body is made and gunas and qualities and law of karma and reincarnation. So I thought for a change, I will do few of them on something related to medicine. Uh, Thought of doing some on cancer since I was reading some of the new things that have happened. But please note that the one that I'm going to start with is not something new. This has been there for several years. However, a lot of people, when I was talking to them, are not aware of this. And so I thought that it would be a good idea to start with something which is very easily available and anybody can do it. So to start with, I'm going to say that there is a low radiation dose CAT scan. CAT scan stands for computerized axial tomography. Some people call it CT scan, computerized tomography. Some people call it CAT or CAT scan. In the CAT scan, there is a sectioning done. Say, for example, if you have a carrot and you want to find out where there is a rotten area in the carrot, or a potato and you want to find out where it is rotten, you may not be in position to see it externally. But if you take small cuts, then at a certain point you can see that certain areas of potato or carrot are not good, they're rotten. So in CAT scan, the idea is to do a sectioning of the body and take a radiograph or a picture. And so it literally shows how it would have been seen if somebody was doing a 3D dissection of the human body or anything that they're doing CAT scan. So the principle is you start the cuts, and the cuts, the thickness of the cut is different in different ways. So there is a one which is called high resolution CAT scan, one which is thin cuts CAT scan, and one is regular. So a few years ago, maybe 2 or 3 years ago, the Medicare and the other insurances followed the suit. They approved a low dose radiation CAT scan to diagnose lung cancer. There was a constant debate going on before that whether there is any value to doing a CAT scan without having any symptoms and without seeing anything on a plain X-ray in patients who are at high risk for the development of lung cancer. So finally, after looking at several studies, the Medicare decided that they will pay for the CAT scan. And so this is called low dose radiation CAT scan. The reason I have included this is in my office there is a poster board which goes through different things related to the health, good, and the diseases, which is health gone bad. And in that they always mention about diagnosis of lung cancer being done earlier. So this low dose radiation CAT scan was approved for a certain group of people. They include this up to age 75, I think, and they also include people who have quit smoking for about 14 years. So ex-smoker for 14 years, people who are current smoker. Some of the people that you could consider including would be smokers whose relatives have lung cancers. So this is a low dose radiation CAT scan. This is available in almost all the radiology facilities. Very simple to do it. As you can imagine from the name, it is a low dose radiation, but there is a radiation in it. So this CAT scan is the one which was approved a few years ago, and we have been doing it. The problem with these kind of CAT scan is it sometimes shows tiny abnormalities which are so small that we don't know what to do with it. The nodules which are seen, which are 1, 2, 3, 4, 5 millimeter in size. For those who are not used to seeing millimeters, 25 millimeters make an inch. So if you have a nodule which is, say, 1/10 of the inch or 1/12 of an inch, or even for that matter, 1/5 of an inch, these are so small that they're difficult to be diagnosed by doing a bronchoscopy, which is an endoscopy. They're also difficult to be diagnosed by doing a needle biopsy, and they're also difficult to take them out through a surgery. So the CAT scan is an advantage if it is abnormal. Further workup is done based on the size. So a particular society came out with ideas as to how often to repeat this CAT scan if the CAT scans are abnormal. So let's say we do a CAT scan and it is negative, we stop, no workup. If the CAT scan shows that there is an abnormality, which is like nodules, tiny nodules. Nodule is a spot, but the spots are so small that, as I just mentioned, not much of an investigation could be done to diagnose, to do a biopsy. So the one way to do is doing an endoscopy of the lung called bronchoscopy. These nodules would not be accessible. Second is putting a needle through the chest wall into the nodule. Again, small nodules you can biopsy. Third one would be doing a PET scan, which I'm going to talk in next couple of videos. PET scan will not pick it up. And open biopsy, which is for surgeon to go in, open the lungs and take out a biopsy. For small nodules, this is difficult, if not impossible, or probably impossible. So in these patients that we see something abnormal, we tend to do a follow-up CAT scan. So how often the CAT scans are recommended to be done are based on the size of the nodule and if there are any other risk factors. Somebody who has, say, for example, breast cancer, and we see a nodule, somebody who has a colon cancer and we see a nodule, versus somebody who is a smoker, somebody who is a non-smoker, somebody who has a low risk for development of cancer, we tend to do a little differently. So for the nodules which are greater than 8 millimeter in size, 8 millimeter is about 1/3 of an inch, we do a repeat CAT scan in 3 months. For the nodules which are 5 to 8 millimeter, recommendation is to do CAT scan in 4 months. For nodules which are less than 5 millimeter, 5 is a 1/5 of an inch, less than that, we do CAT scan in 6 months. So very small, 6 months, medium, 4 months, slightly larger, 3 months. These recommendations are probably based on how quickly we can appreciate a change. So if the way in which these nodules are measured can also have a variation because of the sectioning, because of the human fingers, etc. We cannot do the CAT scan cuts exactly at the same level every time through a tiny nodule. Also, if the CAT scan, as I mentioned, which is sectioning, are done at 3 millimeter, 4 millimeter, 5 millimeter apart, so the two sections are, say, 5 millimeter apart, the nodule, which is 4 millimeter, may be completely missed on one CAT scan while appreciated on another one. And if it is, let's say, 8 millimeter nodule, we sometimes can see a size variation by 1 millimeter or so, simply because of the way in which the cut is taken. So this variation or sectioning is also needs to be taken into account. Also, when the nodules are seen, whether they're solid, like dense, or whether they are fuzzy, which is called ground glass. So the solid nodules are more likely to be cancerous than fuzzy, though this is not a 100% test. Speculation coming out of the nodules are more likely to be cancerous, while the complete circle round nodules are less likely to be cancerous. Deposition of calcium, if the calcium is deposited in the center of the nodule when they are old scars. So presence of calcium reduces the risk of cancer, though sometimes scar cancers can develop. So whether it is the size of the nodule, the fuzziness versus solid, speculation, and deposition of calciums are the statistical chances can be calculated. As I've just mentioned, we repeat the CAT scan because of the doubling time, how a cancer doubles in a volume. And this varies literally from 40 days to 450 days or 400 days. Very slow growing cancer will take more than a year to double. Small, fast growing cancer can double literally in a month and a half. So this is basics on the CAT scan and how the low dose radiation CAT scans are now recommended for high risk patient. We'll talk about this again and then we will start on a PET scan. Thank you for watching. I hope you are enjoying it. You like it and subscribe to it. Thank you. Have a nice day.